Welcome to the 2021 JA Conference. Thank you for joining us. Hold on, admitting more people. A few housekeeping tips before we begin. The session is being recorded. Please submit your questions through the Q&A and we'll get to as many as we can. Hello, my name is Carrie Ferrero. I'm a JA mom, and I'll be your session host for today's session. It's my privilege to introduce our speaker today, Dr. Amanda Feinstein. Dr. Feinstein is a licensed clinical psychologist and a clinical assistant professor at Stanford University School of Medicine. She practices as a pain psychologist within the pediatric pain management clinic at Stanford Children's Health. She also has a part-time private practice in Redwood City, where she works with youth and young adults utilizing approaches such as cognitive behavioral therapy, hypnosis, and biofeedback. Amanda has the unique perspective of being a rheumatology patient, having been diagnosed with JIA as a teenager, while also serving as a health professional for kids with chronic pain. Welcome, Dr. Feinstein.
Thank you so much. I'm really happy to be here. I have been involved with the Arthritis Foundation since my early 20s and wish that I had found it earlier as a teenager. And I'm really excited to be able to talk about pain management today. I am going to be sharing some slides. I really do want to keep it mostly as a discussion. I'm not going to be heavily relying on the slides, but I think it will be helpful to share them. The other thing as well is that I will encourage you to really make this an individualized session for you and your family. There are going to be some things that I might ask you to think about as it applies directly to your individual child. And so there may be times where I say, get out your cell phone to jot some notes down, or if you have a piece of paper to just write some notes down. It's not mandatory at all, but just in thinking about some of the topics we'll discuss today, I really want it to apply very specifically to you and your family. So in a moment, I am just going to go ahead and share my slides. So give me 1 second to do that, and then we will start that portion. All right. And okay, there we go. Okay, so I've already had my introduction and don't need that. But I want to talk just a tiny bit about what the agenda is for today. We're really going to focus mostly on common strategies for managing pain in JIA. But what I want to start with is this part of what helps your child, what makes things hurt more. And this is the part that I was really talking about, getting an individualized sense for your child and your family, what makes a difference. We're going to spend some time talking about distraction strategies. And I think the bulk of the session, we are really going to dive into relaxation-based techniques, and I'll be guiding you through some of those as well. So at probably about a third of the way in, I will ask you to find a comfortable space, if that's possible for you where you are right now. I know people might have a lot going on in their homes or multitasking even, but if you're able to get to a relaxed space, that will be great, because you'll be able to really experience some of the relaxation techniques we'll be doing. We'll discuss a little bit about how you can practice, coaching your child in these techniques. And then at the end, we'll talk a bit about sleep. So you might be wondering, what does psychology have to do with pain? Why do pain psychologists even exist? Like, what is this all about? And from a psychological perspective, what we know is that thoughts, feelings, behaviors, all of those things can impact pain and impact the pain experience. And so I'll give you an example. Let's say your child goes to school. They have a really bad day. Let's say they got teased at school about something, and they come home feeling sad. They're feeling anxious about going back to school again. That might then translate into thoughts about, I don't want to go back to school. School's a bad place. I don't want to be there. I don't like my friends anymore. And then those thoughts and feelings might lead to behaviors such as, I'm not going to school, having some arguments about getting them to go to school. They start avoiding school. Then they miss school. Then they get behind. And all of that stress can then in turn impact pain. So any one of these factors, and we'll be talking about this in a moment from a slightly different perspective, where different layers of our experience can impact pain. But from a psychological perspective, there's a lot in there that can kind of act as a negative downward spiral to impact pain. And after we talk a little bit about that downward spiral, we're really going to focus on how do we create an upward spiral to have a positive effect on pain, and help your children to cope and to be more resilient in the face of pain. So you do not need to write this down. This is our big fancy psychology word, the biopsychosocial model of pain. This is sort of the foundation and the conceptualization of how we think about chronic pain. And for a lot of kids with JIA, there is chronic pain involved, not necessarily just acute flare-ups. With the amazing medications that we have these days, that may be less and less common to be having more of chronic pain. But when we think about the idea of chronic or intermittent or pain, we think about it from a biological perspective, a psychological perspective, and a social perspective. And what I mean by that is, from a biological perspective, that may mean the medications that your child is taking, how they're able to help, the physical therapy, other biological factors of, is there a joint contracture, is there joint damage, are there other physical factors that are influencing the pain experience? From a psychological perspective, is there anxiety? Are there worries? Is a child very depressed? And that can actually have an impact on their that can be kind of impacting their immune system. Is there fear about doing activities? They're afraid they might get hurt. Are those fears realistic, or are they overly anxious about something? From a social perspective, thinking about pain, social factors that influence, is school a supportive environment that helps your child to kind of work through when they're having a challenge? Or is school a really stressful environment that makes them feel afraid and then ramps up their anxiety, which in turn can ramp up their pain? So this is really broadly how we think about pain. And I think it's a really important perspective for parents to just sort of understand from that level. And that's what I want people to do right now, is to think about this in terms of your own child. Now I'm trying to switch slides and I'm having some issues. There we go. Okay. So this is where, if you have a little piece of paper, if you have your cell phone out to take some notes, this is the part that I really want to be individualized for everybody. So I want you to think through, for your child, what tends to make their pain worse from all of these different layers. So let's start out. I'm going to be giving you guys examples. So there may be something I say that fits and clicks for you. There may be other things that I don't say that you want to write down for yourself, or just think through for yourself. So from that biological perspective, what makes pain worse? Does your child often forget to take their medications and then end up with a pain flare? Are there side effects from the meds that they're taking? Are there physical therapy exercises that they're not doing? Are they overdoing it? Have they overdone something physically, where then it's sending, one of their joints or all of their joints into more of like a flare up? So thinking really from that physical perspective, and the biological perspective, are there other elements of their illness that contribute to the pain being worse? Those are the ones generally people tend to be the most aware of. That's what you go to the doctor for, to talk about. And so going down to that next level of the psychological factors, that's where we want to think about, is your child really struggling with anxiety or something like panic attacks? For example, We know that when people are feeling more anxious, especially when they go into that fight or flight response that can really occur when somebody is panicking or having a high anxiety response, one of the things that we know that happens is muscles tense and tighten. And we know that muscles are connected to joints. And so whatever rheumatic disease that your child has, if it's something that involves the muscles or the joints, which is most of them here, if you're at the Arthritis Foundation conference, when the muscles are tighter or more tense, that can directly impact joint pain. So if you think about it from that perspective, my child is feeling really anxious. They're telling you, I'm so anxious. Sometimes you can even see it on their body. Their bodies tense up like this, or they might be shaking from anxiety. That can directly have an impact on their pain experience. When we think about depression, also not getting out of bed if they're that depressed, then their joints might get more stiff because they're just laying around. They're not motivated to exercise or to get out and see people or to do much of anything. And then, like I discussed briefly before, this idea of fear avoidance is something that comes up across many different forms of pain, and in particular, chronic pain. People who are experiencing chronic pain tend to worry about, if I do this activity, am I going to hurt more? Is this going to increase my pain? So, what tends to happen is fear about doing whatever the activity is, and then avoidance of that activity. Sometimes with JIA, that's important and right on the mark. So let's say your kid is hanging out with friends or about to do, 5 miles of bike riding, and they know, I can't do that. That's not fear avoidance. That's being really smart about it and saying, my body is not capable of going on a 5 mile bike ride right now. I can only do 1 mile. So that's actually setting healthy boundaries. When it comes into, and that would fall under the positive, like psychological factors of being strong, having boundaries, knowing what's okay for your body. But when it gets into that sort of negative downward spiral is when there is fear avoidance, which then leads to not doing the things that need to happen. So if there's fears about taking a certain medication, fears about taking a shot that they might need to do, an injection, and then they miss weeks of their injection, that then might have a direct impact on their arthritis. Similarly, there might be supposed to go to physical therapy or supposed to do physical therapy exercises. They have fear that if I do this, it's going to hurt. So they avoid that. So those are some of the psychological factors that are really important to think about. Which ones of those apply to your child? And then from the social perspective, what are social factors that might be having a negative effect? And oftentimes those social factors are very connected to the psychological factors too. For example, if there was bullying or teasing at school, I know some of this with COVID restrictions. Fortunately, we didn't have much of that this past year, but even social media bullying and teasing. Does that then have a negative impact on your child's sense of self, their self-esteem, their body image? And then have an impact on, well, I don't want to go out and do fun things. I don't want to go do this. Or they get depressed from that. Are there family factors at home that might be having an effect on their pain? Are there other siblings who are staying up really, really late at night, and your child wants to stay up just as late, and then they end up not sleeping enough, and then that contributes to more pain? Is there a lot of arguing going on at home, and then that's making your child feel more anxious, and therefore when they're more anxious, their muscles tense and tighten? So really thinking of those social factors that might be contributing to making the pain worse. So usually, I would say almost always, there is not just one factor that is making the pain worse. Sometimes there can be one specific biological factor that has to do with a medication or something like that. But usually it is this combination of factors that contribute to pain being worse or better. So now what I want to talk about, and that's where the rest of this talk is really going to focus on, is what helps to make your child's pain better. Whether that is sending them into remission from a medication, or whether that's just helping them to calm down so their muscles are not so tense and tight so they can fall asleep that night. So think about now for your child from a biological perspective, what are some of the things that really help your child? Maybe with your rheumatologist, you guys found just the right medication that's really working for your child. It's been the perfect fit, not a lot of side effects. They're doing great. Physical therapy or light exercise or aquatic therapy. Those can be such an important part of the care plan. So when we think about that biological physical factor, really thinking about movement. We'll be talking a little bit about pacing later. We'll talk a little bit about yoga, and thinking about moving their body, not getting overly tight, not getting overly stiff, and things they can do to help with that. So movement, not too much of it, finding that right balance. And then other things like hydrating, drinking enough water during the day, their diet. I know, I'm not an expert on diet for arthritis or diet in general, but I know for me personally, there's certain foods I tend to get a little bit more sore when I eat them, and finding out what works for your kid. Maybe diet's not a factor at all, but figuring out what are those different biological factors. From a psychological perspective, really finding ways that your child has to cope with stress is one of the most important things. So what kind of things help your child to de-stress? We'll talk about distraction in a little bit. So this is where things like distraction, relaxation, spending time with friends, doing fun stuff. And of course, they can't spend all their time doing fun stuff. They still have to do obligations, responsibilities. But what kind of things tend to help? And my hope is that you'll learn some new tools and new skills to be able to help from this perspective. Staying active, but in just the right way that works for your child, and ways that just help them to feel more resilient. From a social perspective, things that make the pain better, we can think about the distraction that comes from hanging out with a close friend, having, family time, maybe, for example, like cooking a meal with the family, and whatever your child is physically capable of doing, your child with arthritis, compared to like other family members, doing that together, having a nice distraction. And how the school can be more supportive. I know that there's sessions on that today, but really figuring out which are these things that have been really helpful for your child. So these are as I mentioned, we're going to talk about distraction, relaxation, movement, and pacing. So let's start now with distraction. I will say I'm going to spend less time on this than on relaxation, because there is a video on the conference app that is a conversation with me and a teenager, talking about a teen with JIA, talking about a variety of different distraction techniques. Now, a lot of people attending this talk right now may be thinking, yeah, we know all our distraction techniques. And that may be 100% true, that you guys have tried everything. What I want to put out there is the idea of, are there things you haven't tried? Like maybe your child hasn't really done much baking yet, but that would be really fun because it would get them moving a little bit more. They would enjoy that. Maybe they haven't done painting. Maybe drawing is hard for them, but maybe painting with a big wide brush is something that they can do. So really thinking through, I know electronics is everybody's go-to, adults and children alike, for distraction, but thinking outside the box of electronics and thinking about different things that they might be able to do. Playing games as a family, like board games, getting into a good book series. Maybe they're really into writing, or even playing music, writing music. And I hear all the time from the kids that I work with about their pets. And I know it's not possible for everybody to have a pet in their home, but I know that pets can be a really wonderful distraction and also can be very soothing as well. So check out that other video that will have more information on distraction. And, as we're talking through some of these things, feel free to jot down ideas on what might be helpful for your child. Also, at different points, there might be links that are on the screen, and also those should be in the app as well, about things that you can look up after this session. And excuse me, I'll talk about a couple of those also as we're going along. So exercise, You've probably all heard this many times, the importance of not being too active or too inactive with arthritis. So, thinking about if you guys are a family who we go for walks, that's our exercise. Thinking outside the box, are there other things we could do, like active video games? Do they like getting in a pool somewhere, especially during the summertime? Going for a bike ride, if that's feasible. And then also figuring out where, at different points in the cycle of arthritis or having a flare up or being in remission, there's going to be times where your child's able to do more than at other times. And so I don't know if you've heard it described this way, the boom and bust cycle, but it's the idea of like, I'm feeling great today. I can do all these things now. So then your child decides, oh, I'm going to join my friends for going for a walk all over town for 4 hours. And so they go do that. They come home and then their knees are swollen like balloons. And so then they're having more pain and then they need few days to recover. They're not feeling great. Maybe they get really bummed out about it. Then slowly they start feeling better and the cycle happens all over again. So one of the things that I would recommend is when you notice that happening, and this will depend on the age of your child, what kind of conversation you have and how much autonomy you give them. But really kind of having a conversation around, okay, it seems like you overdid it today. How much did you do? Where's our measure right now? So, okay, 3 hours was too much today. Okay, good. Now we know that. Let's rein it back to about an hour and a half. Next time you want to do that with your friends and see how that goes. And we'll kind of keep track of it. So sometimes those things can be really helpful for parents to keep track of. If you have an older child, like an older teen, they may want to keep pushing the limits and there may be ways that you can help support them in that. Or there may be ways that you can empower them to really think through, like, what were the consequences when I did that last time, unfortunately, and helping them to figure out ways that they can set boundaries and limits with friends of, hey, can we rest for a little bit? Or why don't we do something else in between and go for lunch and then we'll keep walking. So just really helping to support your child so they don't get in that boom and bust cycle over and over again. And specific to yoga, that's what we're going to talk about in just a moment. So oftentimes I know, so when I was in my early 20s, I discovered yoga and it was so wonderful for me. But then there were times where I was having flare-ups and the type of yoga that I had been doing, I really wasn't able to do. It was too challenging. And I think, from magazines to TV shows, all over the internet, we see the kind of yoga which includes headstands and handstands and back bends. And that is not the kind of yoga that I'm talking about for children with arthritis. And I was so interested in yoga. I decided to get my yoga certification when I was also in my 20s. And then was teaching yoga to people with arthritis. I went to a few Arthritis Foundation camps and taught yoga there. And then as part of my research for my dissertation in graduate school, I actually designed a yoga video that is for youth with arthritis. And I wanted to bring it up because it is very gentle. It's the kind of thing that even if your child's having a really rough day, they can do the whole thing seated on the floor. They can do it in their bed. They can do some of it, sitting in a chair if they wanted to. Every posture is adapted so that it has a few different options if somebody is having more pain or discomfort. It's also broken up into different segments, 8-minute segments for the lower body, 10 minutes for the back and neck. So I would really encourage you to check that out and see if that's of interest to your child. And by all means, I'm not recommending just dive in and do any kind of yoga. It really has to be yoga that is specifically attuned to people with arthritis. And that can be an excellent way to get your child not only to be doing a little bit more physical activity, but to directly help their pain. So yoga for arthritis specifically can help with joint pain and stiffness. When we think about joint stiffness, just being able to move the joints through their range of motion, it's kind of similar to what's done in physical therapy. So that's a really important component of it, but also relaxation. doing the deep breathing, body awareness, and strength, and obtaining and increasing strength. So that's something, if your family has not tried yet, I would highly recommend that for pain management. It really can be an important part of the day. And especially if you can get your child to do it first thing in the morning, that's how I live my life. I do some form of yoga or stretching just about every single day. And I find it makes a tremendous difference in my own life. And that was sort of the goal of the study that I did, to see if kids who did some yoga first thing in the morning, if that could help them. And even though we just had a really small sample, the kids did report that that was helpful for their pain and morning stiffness. So moving on to relaxation now. This is where, fortunately, in this day and age, there are so many apps out there that can help support you and your child with doing some of these techniques. I'm going to go over teaching you a little bit about belly breathing today so that you get the gist of how to do this. You might be familiar with it, especially if you've done your own yoga, relaxation, meditation. But I'm just going to do a little bit of teaching on this, and then we'll practice a little bit together. I also want to mention that if you have a really small child who is into Elmo, there is a great video that's called Elmo Belly Breathe, and it's adorable. And that would be something that for the younger kids, it teaches them how to do belly breathing to kind of manage their anger, but it's the same technique that you would use for managing pain. So if we think about relaxation as something that helps the overall nervous system. So if we think about fight or flight responses, when we go into that stress state of mind, an anxious state of mind, that turns on our fight or flight system. And when our flight or fight system is a flight, fight, or freeze system, when that is activated, like I mentioned before, one of the things that tends to happen is our muscles contract. And so if we think about this, from an evolutionary perspective, that is so we can either fight the tiger or run away. But fortunately today, we don't have to run away or fight tigers. Our bodies respond to stress that way. And so when we do things to help our bodies to relax and to get more calm, we can directly start to relax our muscles, which then in turn can help the joints. So there's plenty of other positive benefits that happen from doing deep breathing, doing relaxation. It helps our heart rate. I mean, there's all sorts of different things. There's tons of studies now on meditation and mindfulness. But in thinking about arthritis specifically in the joints, what we're really thinking about is how can we get those muscles to relax to best support the joints. So when we're doing belly breathing, it's also called diaphragmatic breathing. What you want to do is start off by having your child, or if you're practicing yourself right now, which I'd encourage, is to go ahead and put your hands on your belly, or you could put one hand on your belly and the other hand up on your chest. And go ahead and begin to breathe in through your nose, filling your belly with air. And then exhale, also breathing out through your nose or your mouth. Sometimes it's easier for kids to breathe in through the nose and out through the mouth. So breathing in, filling the belly with air, and breathing out. And when you inhale, you should feel your belly rising, and you can tell your child feeling like a balloon. And when you exhale, feeling the belly release that air from the balloon. And just continue breathing. And as you're doing this, I'm going to give just a couple of other suggestions as you're doing this. You may give your child some other image that they like to focus on. The sun shining bright as they breathe in, and then the wind blowing as they breathe out. One of the other things I often recommend is for children to try this lying down, putting a small stuffed animal on their belly. And when they breathe in, they notice the stuffed animal rising up as their belly fills with air. And then as they breathe out, the stuffed animal comes back down again. So the stuffed animal would go on a ride up as their belly fills with air, and then back down again. And I've even recommended this to teenagers as well. It's a way to really make sure that you're doing the technique correctly. And so you can either continue with this breathing as I talk a little bit about the belly breathing, or you can just take a pause from it and just tune into the discussion. So, one of the things with this belly breathing is wanting to make sure that your child is doing it accurately. Because when we're in the fight or flight state, we tend to breathe more into our chest and to breathe more shallow. And so, what we want to do is be taking deeper breaths and breaths down into the belly. And so, the stuffed animal method is a really good way to make sure that your child is breathing that way. Additionally, a lot of times, even adults will notice that, oh, I didn't even realize I was more breathing into my chest. I didn't even know it. Or that they're kind of reversed, where you're inhaling and filling your belly, or inhaling bringing your belly in, and exhaling opposite. I think I'm getting my mixed up as I'm saying it, but you know what I'm saying, that people are often doing the opposite. And so you want to make sure when you breathe in, that's when you fill your belly with air. And when you breathe out, that's when you release the air. So that's a really, really helpful technique. There are tons of apps that can support you in learning that and then teaching it to your child or doing it with your child. So I will have some apps listed at the end. Guided imagery is another technique that, a lot of therapists, psychologists will do this with patients for pain management as well as anxiety management. But it is something that you can do and actually coach your child in. And so I'm going to go through maybe a 4 or 5 minute example right now of some guided imagery, just for making it easy. I'm going to use a beach scene. I know a lot of people tend to find relaxation at the beach. You will need to figure out what is a calm place for your child. The beach may not be it. They may say Disney. They may say the forest. They may say grandma's bedroom. So whatever it is coming up, having them tell you, this is what would be a relaxing place to me. And even having them think back to, do you remember a time when you were there? So I'm going to guide you through this. And this is going to be something that you can kind of have as your own experience right now. And also use this with your child to tune into the senses that we're about to tune into with this. So you can go ahead and close your eyes if you wish and get relaxed, however it is that you're sitting. And go ahead and bring to mind a place that you've been before that was relaxing, calming, or it could just be a place that was fun, somewhere where you have pleasant, positive memories associated with it. And for the sake of this exercise, I'm going to use the image of a beach. But if that's not comforting to you, then you can pick anything else and just allow the words that I say to be changed into words that fit for you. So allow your mind to wander to a scene at a beach that you've been to before. Picturing the color of the water, the sand, the sky. And even if you don't remember exactly what it was like then, just allow your mind to generate those images now. And begin to notice what kind of sounds there were at that beach. Sound of the waves, sound of birds in the distance, maybe even the sound of people laughing and talking. And bringing to mind smells associated with this place. The smell of the ocean, the salt air, and allowing all of these senses to become more and more vivid. There might even be tastes associated with this place, a favorite food or drink that you had at the beach or that you like to have at the beach. And then as all of these sensory experiences are coming to mind, just begin to also bring up the feeling associated with it. Maybe it's a peaceful feeling. Maybe it's a feeling where everything is just right. Maybe it's that feeling of excitement and fun. So just noticing all of the senses involved. And then tuning into your breathing as you let all these different aspects, what you see, what you hear, what you smell, what you feel, as you allow all of those to become more vivid. Just focusing on that belly breathing as those positive images continue. And then taking 3 more deep and full breaths. Good. And then you can wiggle your fingers and your toes and open up your eyes if you had them closed. So that is an example of guided imagery. And it's the kind of thing where you can actually look for a script online if you want to go through that with your child, and just lead them through it. And what you might find is this idea that when the brain gets occupied with all these positive sensations, that it really can help with decreasing stress, decreasing anxiety, and then even in turn, really helping with pain management. So I want to be mindful of time, and it looks like it is 1:50. I think there's 10 more minutes perhaps. And so if Carrie, if you want to let me know how many more minutes we have here.
Yes, it's 10 more minutes.
10 more minutes.
And there is a question in the chat. So.
Okay. Let me go through really quickly these last couple, and then we'll leave time for questions. So I did have a slide on mindfulness. I didn't get to go into detail about that one. What I would say for mindfulness practice is that is more, focusing on the breath, looking to apps to help guide you with that. One like little tiny warning I will say is some of the mindfulness has people focus on it's called a body scan, kind of head to toe, noticing sensations in the body. If your child is having a flare up, you don't actually want to focus on all those parts of the body. It's a little hard for kids to do that practice, I've found. And so maybe focusing on the breath or focusing on sounds, mindful eating or something like that. So importantly, you are your child's best coach. Learn these skills yourself. Coach your child in practicing these skills. If the first time they say that didn't work, it doesn't help my pain, practice again. These take practice. They might find the first time it helps, which is great. In terms of sleep, a lot of this is going to be repeat. It's really important to have a bedtime routine, kind of have a wind down time, relaxation before bedtime. There are apps here. There are going to be more apps that are listed for you. There are great apps that have bedtime stories that are paired with relaxation. So that can be a great thing to use. I'm sure you've heard from your pediatrician to minimize screens before bedtime. Decreasing naps because that can interfere with the sleep cycle. And then finally, some resources. I would strongly encourage you to look up some of these resources. There is a website called The Comfortability that connects families who are dealing with chronic pain. They have workshops regularly. There are online chats. The Pain Bites website is fantastic. Creative Healing for Youth in Pain has group meetings for kids, for parents, and then a whole bunch of apps. And of course, if your child is struggling with mental health, I would encourage you to get some support resources. So I'm going to stop sharing this screen and go back to the other. The time just flew by, so I'm sorry that I didn't get a chance to look at more of these questions. So let's see. So I see a question about my 20-month-old most nights wakes up several times in the middle of the night and it seems like she is in pain. Is there anything I can do to help her sleep better through the night? In terms of, now I'm assuming this is a young child who has JIA or some form of pain, some of what I'm most familiar with is some of the literature on more acute and procedural pain. And some of the things that we know that can be really helpful in those circumstances are and this is more for very young children, but like physical contact with your body, holding your child. If you're in a more calm state and you're doing some breathing, their breathing pattern might tune into yours. If you could put on some of this calming music in the background and kind of soothe them and do some gentle, I wouldn't even call it massage, but just some gentle rubbing, that sense of if you can detect where it is comfortable for them to be touched and soothed, as opposed to if it might hurt, really tuning into that. But one of the things that we know from the pain literature is that parental stress or anxiety can ramp up child stress and anxiety. So the more that you're able to kind of find techniques to manage your own stress and get yourself into that calmer place, that's going to be really supportive of your child kind of being in that more calm place. And, and if they're not as distressed, then hopefully their pain will also be more managed as well. Are there any other questions about anything related to pain management, pain psychology? I know I breezed over the topic of sleep. Let's see. Oh, somebody's asking for some links in the chat. Okay, and they'll be available after session, so everybody can get those. Let me think if there's anything else I breezed by here. I guess, the biggest message that I want to share is that oftentimes, when somebody has any form of chronic pain or chronic illness, there can be just the reliance on, we just have to turn it over to the doctor, and that's all we can do. But there are a lot of things for pain that can be self-managed, and that you can find that you incorporate as part of your routine, and that you really, depending on your child's age, you can help to empower them to learn. The earlier they learn that they can actually do things to help their pain, the more that they will buy into those skills, continue to use them, and do things that really help them, maybe even to prevent a flare-up, to help decrease their pain experience. And I think really taking more of it into your own hands, of thinking, okay, what can I do? What can my child do to support what the medical doctors are doing or what the physical therapist is doing, and things that you can be doing at home. Let's see. So I have some questions here. Do you have any advice finding the right amount of exercise? It seems like my JAA daughter is stuck in the cycle you mentioned of doing too much. So yes, so I think that a couple things. One is experimenting with different types of exercise. If you start to notice that there's certain things that kind of push it over the edge, in terms of exacerbating the pain, seeing if there's ways to mix it up. So maybe like an online video, like I actually was looking during the pandemic for videos. I wanted to do some kind of exercise video, but I didn't want it to be too intense. So I went ahead and found ones that were like for seniors. I thought, oh, this will be good for arthritis. So I found, I don't know that your child's going to want to do that, but something that you find that's a lower intensity kind of workout video or lower intensity exercise, and then combining that with something that might be a more preferred activity. The other thing I would encourage you to do is, in a very just sort of open-minded, non-judgmental conversation, just kind of say, kind of ask her like, how much did you do? Do you think that was too much? Like, what do you think would have been, like, if you could do it again, how much do you think would have been just the right amount of time to do that exercise? And then just say, you know what? I think I'm going to write that down. Or do you want to write that down, depending on how old she is? And just say, okay, keep that in mind. The next time you go to the gym or you're doing this workout thing, why don't you do half that amount and see how it goes? and then tell me and let's talk about it. If it's still too much, we'll talk about it. Maybe it's too easy for you, but really kind of get your child to be, sort of tracking it, even if it's just mentally tracking it, of what is too much, because sometimes you just don't know what's too much. And everybody is going to go over that limit sometimes, because when you have chronic pain or you have arthritis, it's like you don't always know what that limit is. And sometimes it changes, and it can change based on the season, like the weather. It can change based on amount of stress, or medication or a flare up. But just kind of noticing and having awareness around it is super important, of knowing this was too much. How should I do it next time? And just having like a super open conversation. Like, it's not their fault at all. Of course, they just wanted to have fun. Who wouldn't? But let's think through it and let's just problem solve it. And the last thing I'll say is, I know that I recommended at the end in terms of, seeking mental health support. A lot of, since the pandemic, so much of mental health support all of it has transitioned to online through telehealth. So if you happen to live in an area where it's really hard to find mental health support, go outside of your local city and just start searching in your state, even, because anybody who is licensed in your state will be able to do telehealth. The other thing is, certain states, I don't remember off the top of my head, but it's a bunch of states in the South kind of have these reciprocal licenses, at least I know, for psychologists. So you may be able to get services with somebody who's out of state, but can provide services to your child. The other things too are asking your pediatrician, and for resources. But so much of mental health right now, our services are online, and it's just a matter of finding somebody that you can kind of set up or hook up with your child. And it's also specific. If you're looking for treatment for anxiety, depression, specify that when you're looking for that provider. If you're looking for like 10 sessions of pain management, also specify that and say, is there anybody who has background in pain management or chronic illness? So that's what I recommend from the mental health perspective. Let's see. I know we only have 1 minute left, but I'm happy to hang out for any additional questions if anybody has any. And I think that's about it.
Well, thank you, Dr. Feinstein, for being with us today at the J Virtual Conference. It means so much to us. And thank you to all our attendees for joining us for our breakout session today. Please take a moment to provide feedback on the session by completing the conference survey in the app. This will help us guide programming in the future. Be sure to come back for our next round of live breakout sessions at 2:15 Eastern and our closing general session. We'll start promptly at 3:30 p.m. Eastern time. You can find the Zoom link for the general session in the conference app. Be sure to check the conference app for the Arthritis Foundation resources, and I encourage you to take part in the JIA Insights today. You can access that link in the app as well. And the resources, some of the resources Dr. Feinstein spoke about are in the app for this session. You'll be able to find it under, if you open up the description, she has the information posted there. So thank you, everyone.